Excellent. Thank you so very much, everyone, for coming along to this evening's presentations of Streams of Solidarity. My co-host this evening is Alison. She'll be helping me out in the chats. Yeah, as Dr. Shireen is going to be giving us a presentation this evening of some of the things that she's worked on. If you have any questions or anything like that, just go ahead and pop them into the chats and we'll go ahead and put all of those together and we can put her in the hot seat at the end to test her general knowledge. Thank you very much for coming along this evening. Our guest this evening is Dr. Shireen Kassam. She is a consultant hematologist, certified life medicine physician, and visiting professor of plant-based nutrition. She is founder of Plant-Based Health Professionals in the UK. Yeah, thank you very much for coming along and visiting us this evening, Dr. Shireen. How are you doing?
Yeah, all good, thank you. And thanks, Michael and Alison, for the invitation. It's a great pleasure to be here. I'm just going to kick off with making sure I can share my slides. So I hope I've followed the remit correctly, and I am here really to put plant-based diets and nutrition in the context of healthcare, and what we as a group of health professionals and our supporters have been doing to try and embed healthy plant-based nutrition into the UK healthcare system to varying degrees of success. So it's just sharing experience and hopefully picking up some ideas from you guys as well. So Michael's already mentioned what I do. So I work as a haematologist at King's College Hospital in London. And I'm also certified as a lifestyle medicine physician. So that means that I incorporate principles of lifestyle medicine into my clinical practice. And we'll come back to that because it is relevant to the field of plant-based health and plant-based nutrition. And my vegan advocacy really is through my community interest company called Plant-Based Health Professionals UK, which I'll be talking about, and I do hope most of you have heard of. And as a follow-on to the founding of Plant-Based Health Professionals, we do have a healthcare service where you can make virtual appointments to see clinicians who have a background in lifestyle medicine and plant-based nutrition on our healthcare platform called Plant-Based Health Online. I provide education on the topic of plant-based nutrition at the University of Winchester, and I've been vegan since 2013. So I don't need to tell you why we are so interested in changing the food system and why it's crucial to the future of everyone who we share this planet with. So the food system is at the centre of our climate and biodiversity crisis. I'll show you how it also relates to our current health crises. And of course, the food system is not ethical. We slaughter nearly 80 billion land animals a year, nearly 2 trillion fish, and yet nearly 1 billion people globally remain hungry. So our food system is not fit for purpose and needs to change. So one of the problems the food system is creating is ill health, and this is globally. So the Global Nutrition Report back in 2021 stated that unhealthy diets are responsible for 1 in 4 deaths globally, and in Europe and the US, 31% of premature deaths are due to an unhealthy diet. And at the same time, the food system as a whole is creating 35% of greenhouse gas emissions. So why is the food system and what we eat so unhealthy? Well, we had this large analysis from 195 regions around the world published back in 2019, demonstrating that unhealthy diets were in fact the leading cause of preventable death and premature death. And the reason why the diets are unhealthy, regardless of where anyone was around the world, is that they're too high in sodium, which is a reflection of our reliance on prepared and packaged foods, so so-called processed and ultra-processed foods. And they're wholly insufficient in healthy plant foods, so fruits, vegetables, whole grains, beans, nuts and seeds, the only foods that have been associated with promoting good health and preventing chronic conditions. And as a consequence, this unhealthy diet is leading to premature deaths and living in ill health from cardiovascular disease, cancer and type 2 diabetes. And this relates to the UK as well. And as a consequence, of course, not solely just because of our diet, but given that our diet is the leading cause of chronic conditions and death, the Health Survey from England shows us that 42% of adults aged over 16 have at least one long-standing medical condition, and 16% of children have a long-standing medical condition. So not only is our diet affecting the climate and ecological crisis, it is keeping us in ill health, and many of us are living with these chronic conditions. And as a consequence, even though life expectancy has slowly increased over the last few decades and more recently plateaued, the average health expectancy, so the healthy life expectancy for the UK, is only about 68 years. So we're spending on average 10 to 12 years in ill health. And the stats are quite alarming, really, when you consider that 80% of the chronic conditions that we are seeing in the healthcare system are directly related to an unhealthy lifestyle, which includes a poor quality diet. And this problem was further exposed during the COVID-19 pandemic, that this level of comorbidity was leading to adverse outcomes. So the left-hand panel, you can see the BBC News article referring to a UK-based study of called Open Safely. It analysed 17 million health records from GP surgeries, showing that more than 90% of people who died in the first wave of the pandemic had at least one underlying health condition. And similarly, in the US, when they analysed 1 million admissions to hospital, they showed that 60% of these hospital admissions, even though the patient had COVID, was actually driven by their underlying health condition of high blood pressure, heart failure, obesity, and type 2 diabetes. And then we learned from the Zoe COVID study that actually, when they looked at the dietary intakes of around 500,000 participants of this COVID app study, these participants lived in the UK and US, that those eating a healthy plant-based diet centered around whole plant foods, so that's fruits, vegetables, whole grains, beans, nuts, and seeds, had a reduced risk of getting COVID-19 by around 10%, but more importantly, had a reduced risk of severe COVID with a risk reduction in the order of 40%. So what is a healthy diet, and what are the foods that promote health? Now, I said at the beginning that I'm a certified lifestyle medicine physician. So in case you haven't heard about lifestyle medicine, it's one of the most rapidly growing medical specialties globally. It was formed, of the American College of Lifestyle Medicine is the founding organization, formed in 2004. And then from 2015 onwards, it's become a global movement. And we've also got the British Society of Lifestyle Medicine. And it really pays attention to the root cause of the vast majority of our chronic conditions, which does relate back to our lifestyle. And lifestyle medicine promotes 6 healthy pillars: healthy nutrition, regular physical activity, restorative sleep, avoiding toxins like alcohol and tobacco, fostering healthy relationships, and managing stress. When it comes to a healthy diet, the American College of Lifestyle Medicine have a position statement that says that they recommend an eating plan based predominantly around a variety of minimally processed fruits, vegetables, whole grains, beans, nuts, and seeds. So you've got half a plate of fruits and vegetables, a quarter whole grains, quarter plant proteins, which we know come from tofu and chickpea, and nuts and seeds and pulses and lentils, and mainly water for thirst. Lots of herbs and spices for the flavour, but also for their anti-inflammatory and antioxidant properties. And they call this a whole food plant-based plate. So to you and I, it's a healthy plant-based or a healthy vegan diet. There's no requirement for any animal foods in these recommendations. Whether people choose to consume them, that comes down to personal choice, but they should be minimized and not the predominant food consumed. And we know that this type of diet, plus healthy lifestyle factors that I've mentioned, can really address the root cause of chronic conditions, which really stem from an unhealthy gut microbiome, adverse changes to the expression in our genes, that's called epigenetic changes, and stress to the cells. So when you damage the protein and the DNA through whichever sort of factors that are predominant. And so diet can cause all of these changes and cause adverse impacts, ultimately leading to inflammation and then chronic conditions. But the good news is that we can intervene at any point. And even if you have a chronic condition, you have the ability to intervene with intensive lifestyle interventions, which can reverse these root causes of chronic conditions. And so plant-based diets are embedded in virtually every single disease-specific guideline globally. I've chosen just a few just to highlight how plant-based nutrition really is centre to all our preventative guidelines. So this is the American College of Cardiology 2019. They recommend 2 diet patterns: plant-based, which includes vegetarian and vegan, or Mediterranean. We know that Mediterranean diet is healthier than the standard Western diet, certainly the standard British and American diet, and centered around lots of healthy plant foods, but of course does include consumption of some animal foods. When it comes to diabetes remission, we now talk about trying to support people to put diabetes into remission, because it's caused by underlying lifestyle risk factors, of which diet is a major driver. This is an international consensus published earlier this year, stating that the primary intervention should be one that's based around whole plant foods, grains, vegetables, legumes, fruits, nuts and seeds, whilst avoiding or minimizing meat and ultra-processed foods. So again, diabetes remission, reach for the plant-based diet. And these guidelines for cancer prevention from 2018 eat a diet rich in whole grains, vegetables, fruits and beans. So there is no disagreement that a plant-based diet really is optimal for us as humans. And you'll be very familiar with this, the Eat Lancet Planetary Health Plate, which presents not only a healthy diet, but one that's sustainable and that will keep the food system within planetary boundaries. And here you can see that the plate is, again, half fruits and vegetables, almost a quarter whole grains, plant sources of protein. And if you are going to consume any animal products, it really should be minimized to less than 15% of your energy intake. And it's quite clear that it's not necessary, but if you do consume, it should not be more than 1 portion of red meat a week, 2 portions of poultry and 3 eggs. And it's estimated that if globally we transition to this type of diet, we would save 11 million premature deaths per year. And as I've said, keep the food system within planetary boundaries. And of course, freeing up a lot of land that could be put back to nature and for storing carbon. And this is put into guidance from our government. This document is aimed at health professionals in the UK, climate and health, applying all our health. It states that a diet rich in plant-based foods and lower in animal source foods are better for the environment and of course better for our health. So we've been told as health professionals we should be promoting more plant-based diets. And for at least the last 2 years, major medical journals have been publishing statements like this. So this is in the British Medical Journal or the BMJ. Without decisive and urgent action, the climate crisis will increasingly undermine human health and disrupt healthcare delivery. There are both moral and practical reasons for health professionals to be at the forefront of climate action. And you and I, we know that includes advocating for change to the food system. And we see medical authors and researchers writing statements like this. It's now come down to whether you're practicing ethical healthcare or not. And really, we've got enough evidence that plant-based diets not only promote individual health, but is essential for the future health of our planet. And this paper states plant-based diets are a powerful tool. Not using and advocating them is not only unethical, but harms patients and the planet alike. And the UK has embraced this knowledge within healthcare curricula. So, for example, at the end of last year, we now have a nutrition curriculum for medical students created in conjunction with the Association for Nutrition and those that create medical school curricula. Disappointingly, this document doesn't really talk about plant-based diets. It talks about vegetarian and vegan diets under the title of restrictive diets. There's also outcomes for graduates that clearly state that all medical graduates should understand the principles of healthy diet and be able to support their patients to adopt healthy dietary behaviours. And more recently, which is relevant to us here in the room, we do have an Education for Sustainable Healthcare curriculum by the Medical Schools Council. And here there is clear recognition that for sustainable healthcare within the NHS, that we do need to address not only food as medicine, but also promoting the benefits of plant-based diet for planetary health as well. And thinking about sustainable healthcare, I mean, of course, the most sustainable healthcare is the healthcare that we do not need. Yet the NHS only dedicates about 5% of their budget to preventative healthcare. So we really need to be working more upstream that addresses the true root cause of chronic conditions, rather than waiting till individuals have conditions that then need more pharmaceutical approaches. So bit of a long introduction to why we exist. So Plant-Based Health Professionals UK, I founded back in 2018, and we provide education and advocacy on whole food plant-based nutrition for the prevention and treatment of chronic disease, as well as for supporting planetary health. And I told you at the start I became vegan in 2013, but it took me a good 4 or 5 years to feel comfortable with the knowledge around diet, nutrition and health. I hadn't been taught it in medical school, so I had to start a period of self-education through courses, through reading papers, attending conferences, and finally became confident enough to present myself to give talks and provide education. And I did that first at VegFest in 2017, and where I met a number of like-minded health professionals, which really sort of motivated me to bring more of this nutrition into mainstream education. So we started off by testing the water back in 2018. In March, we put on the first plant-based nutrition healthcare conference in the UK, and we were sold out within weeks. And from there, I met loads of like-minded people. The conference was open to health professionals and the general public, but it was really well received, and there clearly was an appetite for more of this type of education. And from there, the vision of plant-based health professionals was born. And I mean, obviously, this is a big aim for what is still a small team, but what we aim to do is provide education for health professionals. This is through our membership program, for conferences when we were doing live conferences, and of course our education program that's online as well. We also are very happy to provide education to community and public level, so in schools and community and faith groups. We provide talks for events. We have a lot of online resources. We share patient success stories. We keep up-to-date articles that are easily accessed and read by non-health professionals, and we provide guidance on cooking with demonstrations and recipes and so forth. And obviously the ultimate aim is to be able to influence policy in the UK, and to date we've done that by aligning ourselves with like-minded organisations. So for example, the Plant-Based Food Alliance here in the UK. We're also working with the UK Health Alliance on Climate Change, and we've found allies very much across the climate movement with Doctors for XR, the Eco-Medics and so forth. And obviously we are here to support you in the vegan movement, to support your advocacy and get professionals on board supporting your work too. So during this time, I've had the opportunity to work at the University of Winchester, that was obviously bold and enlightened enough to allow me to create a course which is accredited for health professionals, called Plant-Based Nutrition: A Sustainable Diet for Optimal Health. This is the 4th year I've been running it. It's been exceedingly popular and well received with excellent feedback, and it's now recommended to all GPs in England as part of the Green Impact for Health Toolkit. So this is the only university-based course that I'm aware of with CPD accreditation. We also wanted to provide credible resources. You know, I've told you that this information needs to be within healthcare curricula, but where are the resources and educational books that are going to be used in these curriculum? So it was a great pleasure to work with my sister for the second time, because this is our second book, and our registered dietitian friend and colleague Lisa Simon, who's part of Plant-Based Health Professionals, on this co-edited textbook that has numerous chapters on the role of plant-based diets in various health conditions, and also the impact on planetary health and how to maintain good health on a plant-based diet. So that is accessible and available for everyone, to be honest. It's been made very affordable as well, so do check it out. And then during the pandemic, we did move our education online, and we've continued that because it's given us a global reach, and we have members and participants from all over the world now. And again, it's a way of providing credible education. These are CPD accredited, meaning that they can count towards health professionals appraisals. They also count towards revalidation for the lifestyle medicine diploma globally. So do check out our website for the webinars. We've had a lot of interesting topics. And then you might know already that I provide and write a weekly blog, really summarising updates on the evidence supporting plant-based nutrition for both individual and planetary health. The number of studies that come out constantly on a daily basis is overwhelming. So it's a way of keeping myself up to date for all the teaching I do at the University of Winchester and through my advocacy, but hopefully it's supporting you guys to keep up to date on the evidence and abreast of all the nonsense that we read in the general media. The other bit of success of a project that's been led by Hayley Tate is a project or a program we call Cooking for the Climate. So the other opportunity we've taken advantage of is that, as I say, within medical schools, there are a lot of medical students who are advocating for sustainable healthcare. They're championing, climate change mitigation strategies. There are modules on planetary and global health. And within this context, we've been able to provide a course called Cooking for the Climate at 3 universities, Exeter, Southampton, and this year King's College London will come on board. And that's Hayley there, who's our GP based in Liverpool, who also has a community cook school called Vinnie's Kitchen, and is now teaching in medical school. She's an author and a chef, and you can look out for all her books in wherever you buy her books. But she is running this module at 3 universities. And the good thing about the UK education system for medical students is that 10% of the curriculum can be chosen by the students. So it's in addition to the regular curriculum. So that's how we've been able to offer this as what is called a student selected module. And then we've spent at least the last 18 months or 2 years presenting at Grand Rounds. So every hospital has Grand Rounds in the UK. So that's an weekly educational offering for all hospital staff in the hospital. And of course, it used to be in person in lecture theatres, and the pandemic put it all online, which means that you can offer your talks virtually to any hospital around the country. And of course, everyone's very happy to have offers of participation, given how difficult it is to fill these sort of educational programs. So myself and LJ Smith, who's my colleague at King's College Hospital and also a plant-based health professional herself, part of our group, we've given, well, you can see all those hospitals we've presented at. And just to say, we don't shy away from talking about the impact of animal agriculture on the animals, on the planet, to everyone around. So we talk about antibiotic resistance, we talk about pandemic risks, we bring it all together with the health aspects of a plant-based diet. And we've tried our best to also be writing and publishing peer-reviewed papers, because of course that's the language of medicine and research. You're credible if you produce original research. Some of it has really just been to get education into reputable sources like the British Journal of General Practice and the American Journal of Lifestyle Medicine and so forth, and the British Journal of Nutrition here. So that's something we like to dedicate some time to. We try to make life easier for practicing healthcare professionals. You'll know that all of us as doctors complain that there's never enough time to see your patient, to provide the counselling and support they need to make healthy lifestyle changes. And so we've tried to make it easier. And actually our fact sheets are some of the most widely used resources by healthcare professionals for themselves, but also for supporting their patients. We've covered so many topics. There's at least 40 different fact sheets on our website. And if you've got topics that you'd like us to cover, just drop me a line. We're really happy to create resources that are useful and are being used. And then just to talk about workplace opportunities. So, I mean, a while back, we did have this grand plan of having a national campaign of which we called Giving Bacon the Boot, or Give Bacon the Boot, to get at least processed red meat out of hospitals. But running a nationwide campaign is a full-time job, of which I had already. And really, there are complexities to the food provision that are unique to each hospital. So really, I've started locally with my own hospital, and it's great having an ally in LJ Smith, who's also an active vegan and a campaigner for climate and sustainable healthcare. So we started 2 years ago now running Veganuary and No Meat May, and really have got quite a lot of messaging out to our staff. You know, we have 10,000 staff at King's College Hospital, and although I can't say that everyone has gone vegan, but clearly there has been some support for that. And one of the main reasons is because our CFO, so our Chief Financial Officer, has a vegan daughter, is married to the CEO of Wagamama's, and therefore has been very supportive of our request to try and change the food environment. And he's also the sustainability lead. And as I mentioned, you know, we have been called to action as healthcare professionals. The NHS was the first healthcare system globally to declare a climate emergency, and it's made a commitment to reach net zero emissions by 2040. And of course, without addressing food for their million members of staff and their, you know, thousands of patients every day, it's going to be difficult to reach that aim. So sustainable diets is part of the solution to sustainable healthcare, not only because we can use it for preventative health, but for lowering carbon emissions. And so we were able, in both our King's strategy, which is a 5-year plan that every hospital has, and the green plan, so our sustainability plan, clearly states that we're going to move towards a healthier, more plant-based menu that will progressively remove processed red meat. So we've had the executive go ahead, and I believe that this week they're discussing whether staff events should all be plant-based in their catering. I think there's going to be pushback, but at least it's on the agenda for the exec. And I mentioned Hayley. She has a community kitchen where she teaches hands-on cooking to various community groups, schools, those that are disadvantaged, and gives all the meals to the homeless in her community in Liverpool. And we're very happy to be able to support her work and sponsoring the kitchen, and she does loads of cook-alongs for us too, and she's had medical students from the local medical school in Liverpool along to the kitchen too. And then I mentioned at the beginning, you know, we wanted to bring this to the mainstream of healthcare provision. It's actually really hard to get into the sort of NHS funding stream, so we've created at the moment a private healthcare provision, plant-based health online, hoping that we can get enough data together to ultimately be part of everyday NHS care. But again, uphill struggles there. And we've got lots of everyday resources that are great for you guys to use or share with your audience. So for example, a 21-day plant-based health challenge. This is email-based, lots of recipes, information, videos, and so forth. And we spend a lot of time trying to get our message out to the media, like you guys. We work with Eden Green PR, and they've done a great job at getting us features in top-tier newspapers. And just to end by just saying that, you know, internationally there has been movement in getting plant-based nutrition into curriculum. So this is New York University hospitals. They have a culinary medicine course that is all fully plant-based. At Wayne State University, There's a mandatory plant-based nutrition curriculum for medical students. And you'll all be aware of Mayor Eric Adams, who's really shaping the future of healthcare in New York. And we heard a couple of weeks ago that New York City hospitals have made plant-based meals the default option. So rather than vegan meals being on a special menu, they are the default option. And people would have to ask for animal foods if that's what they wanted. Influencing policy, as I've said, is more difficult, but we've mainly done that by joining as affiliated organisations of those groups that do have the influence with Parliament, with policymakers, and quite us, I guess, we're finding allies, as I say, in the climate movement. So, for example, we are running a session on the 14th of December on health action on transition to more sustainable diets, UK Health Alliance on Climate Change, of which all the Royal Colleges and specialty organisations, medical specialty organisations are members of. And so hopefully will give us a good audience to present the basis for a plant-based food system to them. And I guess just to let you know that all of us are at the core ethical vegans and try and do our bit to support you guys, but are truly in awe of the work that you are doing. So thank you. And I'll leave you with this that made its way into the British Journal of GP, a journal. Our food choices matter. Without addressing food production, we cannot meet climate targets. Health professionals should be leading by example and supporting patients to make healthier choices that will improve their quality of life and those of future generations. And this is acceptable to now be writing in leading journals in the UK. So I'm hoping we are getting our message out there. And I, of course, have a lot of people to thank for the work that we've been able to do, albeit small, over the last few years. All of the plant-based health professional team members and all our actual members. So membership is open to everybody. It's really low cost, and it helps to build a network of like-minded individuals who share the passion that we all do for promoting a plant-based diet and food system. Of course, my family, we work together really closely. I'm pretty sure my sister and mum are in the audience today. And of course, all those individuals that have given freely of their time and sometimes their own resources to support us. And we work with great organisations. Mad Ideas does our website. We've been funded by Veg Fund and ProVeg in the past. We work with Eden Green PR. I should have actually put vegan accountants. We work with them too. And then our core funding currently comes from the Karuna Foundation. And I have two reminders at home about why we're all here and why we're so passionate about our shared mission. So thank you.
Thank you so very much. Who are those two lovely puppies there that you had at the end? Who is that?
So the larger and older dog is Pansy and the younger one is Belle. And I'm slightly worried because I've got the door closed and they are roaming freely around, which is always a recipe for disaster, sadly.
Oh, you're going to find a mess in a bit here. That's great. Well, thank you so very much for that presentation. I always get really, really excited when speaking to anyone in the medical community, because it's through medicine that you do really find how everything is so incredibly attached. Everything outside affects us on the inside, and what we do to ourselves on the inside has a tremendous effect to us on the outside. And it's that wonderful knock-on effect. And yeah, also just really wanted to say too how amazing it is that, you know, you've done 2 books with your sister. You said that you went vegan in 2013. How was the transition for the rest of your family? Did they all come along with you? Or was it a bit of a like pulling teeth at times?
No, I was really fortunate. So the decision was made alongside my sister Zahra, who's in the audience, and also my sister Layla. And you guys will know that they're both in this advocacy space themselves. So Layla is co-founder of Animal Think Tank and Zahra is co-founder of Plant-Based Canada. So we came to the realization together because we spend time together, we chat, we are able to discuss these issues. So we transitioned together around the same time in 2013, having had various periods during our life when we were vegetarian, but certainly not brought up vegetarian. And then we were slowly well, maybe not so slowly, we were able to persuade our parents that they should also adopt the vegan philosophy and certainly a plant-based diet. And we've got my mum in the audience too as well. So I always forget how long they've been vegan, but at least 5 years, if not longer.
That's fantastic. Yeah, I mean, me and my journey, the whole reason why I started looking at it was because on my dad's side of the family, there's a lot of heart disease going on, but and heart disease that's everything to do with the circulatory system. That's one of the default things that people think about in terms of health benefits when going vegan. But a lot of people don't really take into consider at the same time a lot of gut health. I have a friend who I just found out about a month and a half ago that they had finished a course of steroids that they were on for about 3 months because of what was it? Colitis, Colitis. What do you know about switching to a plant-based diet and with gut health and other knock-on effects that might have?
Yeah, no, I mean, as you say, adopting a healthy plant-based diet is one of the best things you can do for promoting good health for us as an individual. And as we are realizing, the health of our gut is so important for the health of the rest of the body, because our gut bacteria, when in good health, will create these chemicals called short-chain fatty acids that communicate with the rest of the body. So they make sure our immune system is working well. The gut bacteria influence our mental and physical well-being, communicate with the heart, the lungs, our joints, our brain. So really good health depends on good gut health. And when you think about what promotes good gut health, there's only a few things, and our diet is one of the key factors. And what we need in the diet is fiber, polyphenols, so all those dark compounds that you find in all the delicious fruits and vegetables, resistant starches, from our starchy vegetables, and also fermented foods are great, and there's plenty of variety of fermented foods. And so we're realizing in all specialties that if we want to improve heart health, in my field of cancer, improve cancer outcomes, we need to be thinking about gut health. And colitis, as you say, just inflammation of the gut. There's lots of causes of that, but certainly a healthy diet is essential for trying to heal an inflamed gut.
Yeah, thank you. And yeah, before I pass off to Alison, I just want to remind everyone in the audience, if you do have any comments or questions, please go ahead and pop them into the chats and we will go ahead and come around to them. So yes, Alison.
Well, I just wanted to say, this is very anecdotal, but and I didn't know this, but I went vegan 30 years ago and I had one of the worst cases of psoriasis ever in the country, like really horrible, thick and yuck, and a bit like the singing detective around my neck. It was horrible. And as the years have gone by, I've pretty much got none. I mean, I have tiny little patches on that, so minimal now. And I'm sure that's because of my diet. So that's just anecdotal, really, just one case. But when I was vegetarian, I think it got a bit better, and then when I became vegan, it got even better.
Yeah, but you're definitely, there's definitely more than you as a case. You definitely hear about people whose psoriasis and the psoriatic arthritis. So one of the cases we wrote up was of our patient advocate, Kate Dunbar, who also happens to design all our fact sheets as well. She's been off her medication for psoriatic arthritis for 4 years, now running marathons. So she came from not being able to walk to medication to then coming off and running half marathons. So I think, like with all these conditions, you want to dampen down inflammation, promote the immune system to work in the way it should. And, diet and healthy lifestyle is a key component of that. Of course, we can't get rid of all conditions in everybody, but it gives you a really good basis on which to then be using, conventional sort of medical treatments as well.
But I haven't needed to treat it. It's just like nothing really there at all for years and years and years. And I sort of almost didn't notice it. But then I thought, hang on, I think this is because I've become vegan. Also with my sister, actually, sorry to go on a little bit about, but she was very strict vegetarian and then had a high cholesterol. And then she asked that, she said to the GP, can I do it myself with a vegan diet? And she did, and it's come down.
Yeah, I mean, I
So
think
she's now vegan.
One of the key benefits of eating a healthy plant-based diet is that it's virtually absent in cholesterol, and it's pretty low in saturated fat, which is the sort of more important bit. You know, animal foods high in saturated fat drive up your blood cholesterol. So removing even the sort of dairy and eggs part of vegetarian diet tends to have a benefit for cholesterol levels.
Can I just ask, other people have any questions here? I mean, we're talking happily away, but anybody in the audience like to? The fabulous Shireen something. Thank you ever so much, Shireen. That was wonderful, and we'll put it on our YouTube, won't we, Michael? Lovely. Anyone else want to ask anything? I mean, it was incredibly comprehensive and informative, so it may be that I did have one question, and then you answered it with your presentation.
Well, I'll say this. One of the presentations I've seen you give online was with the Party for the Animals, which is a Dutch political party. Do you often work with various political organizations or policymakers in helping put together legislation or guidelines?
Well, I mean, I think that's the ultimate aim, Michael. That's probably the only political conference I've been invited to, sadly. I'm surprised you remember that, because it was I think it was last June, wasn't it? Yeah, I mean, I think, as I say, the main way, I mean, we're part of the APPG for food and health, so we go along to those meetings and we've had a chance to present there, but sadly, I think with all party parliamentary groups, nothing really moves outside of the discussion. I'm not sure that it necessarily influences much policy. I think, as you say, the UK Health and Climate Alliance, they've been putting policy papers forward and really endorse a sort of sustainable Eat Lancet style diet, so that's useful. And Marissa Heath, who's leading up the Plant-Based Food Alliance, is managing to get the ear of politicians and policymakers, and we're sort of part of that group. And I contributed a bit to the Plant Europe work a couple of weeks ago, that are trying to sort of move or shift or make progress in terms of plant-based provisions sort of Europe-wide. So there's small opportunities, but I think, you know, I don't know, you know what our government are like. It's very difficult, even though the National Food Strategy recommended, you know, a shift to more plant-based diets and reducing meat consumption and increasing fruits and vegetables. We're just really not seeing that put into actionable policy documents, really. The last policy document I read from the government was sort of putting attention more onto technological solutions and alternate proteins, and, you know, that sort of language that makes people think that we haven't already got the solution. We have got the solution. We can easily move towards fruits, vegetables, whole grains, beans. We can start growing the food that promotes health rather than committing 70% of our farmland to raising animals. So I don't know, it's all rather disappointing for us here in the UK, isn't it?
Yeah, certainly is. I think it's one of those things where we have all of this momentum and all of this potential energy that's just building up more and more and more. And it can be a bit soul destroying that nothing is happening. But then, yeah, going back to the Dutch, you can see in Netherlands, the Party for the Animals, they have several seats. They've won several seats in the north of Netherlands there. So you can see this movement starting to build up, and just kind of being patient, but not too patient, and getting it going over here. Also, another thing I really wanted to ask you about too was how would you suggest people talking to their GPs about promoting a plant-based diet from their surgeries?
Yeah, that's an interesting question, and I guess it will partly depend on your sort of knowledge and relationship with your GP, but if you're having to see them or go to the surgery, it is a great chance to sort of be advocating for healthier diets and lifestyle. The response will vary, I think, because GPs at the moment are so have got so much work on, but I think just making sure your GP and your surgery know that plant-based diets are healthy at all stages and ages of life. That is a statement that our health organizations endorse, and just signposting to some of our resources and the credible information that's out there. And as I say, the GP community is sort of advocating for this within their sort of greener practice and sustainable healthcare agenda. I think it's just hard translating it into patient practice, because changing behavior is so much more challenging than the type of medicine that we practice, which is very much sort of you've got this, take this medication or have this procedure or whatever. We need to sort of change the food environment for those that need this change the most, and affordable diets, whether they're plant-based or not, healthy diets, whether they're plant-based or not, are not affordable or accessible to vast swathes of our society. I mean, we're hearing that nurses are having to go to food banks, so it is difficult, and we have to meet our patients where we are, but there's no excuse that we can't make them aware of the evidence and the resources, and there's plenty of things to be downloaded from our website that could easily let them know that this is a good way of supporting their patients' health.
That cost thing is one of the big topics that people do like to talk about, especially in the US. People will say we'll stay away from eating whole, healthier plant foods just because it's so much more expensive, or not so much more, but it is a little bit more expensive. But when you think about the long term, what's going to save you more money? Is it going to be spending out that little bit of extra money right now, or later on in the future, spending that money on medication and in hospital stays from the knock-on effects of having a diet that is so toxic to the body? Do you know of any research that has a correlation between animal agriculture and environments, and in a way that promotes better health? So like in larger cities, they have the Clean Air Act, where you have low emission zones in cities because of the relationship to various types of lung cancer and whatnot. Do you know of any research that is in correlation with environmental in a broader sense with animal agriculture?
Yeah, well, that's interesting. I mean, there was a paper last year, sort of beginning of last year, if I remember correctly, looking at causes of air pollution in the US and what the main drivers were. And actually, animal agriculture came out top in terms of driving air pollution. So, we think of air pollution as, cars and transportation, don't we? But actually the food system, through nitrous oxide and, creating ammonia in the atmosphere, is actually driving worsening air pollution. And then, of course, for people that live around these factory operations, there's pollution of water, land, and air. And then we're actually in antibiotic awareness week at the moment, raising the alarm, hopefully, on the rates of antimicrobial resistance globally, which is at really concerning levels, with 1.3 million people dying of antibiotic resistant infections back in 2019. So that's the latest stats. So in terms of how the animal agricultural industry is contributing to this ill health through the production of food, well, it's driving the risk of antibiotic resistance through their widespread use of low-dose antibiotics in that's necessitated by these awful conditions these animals are kept in. So those are two examples, antibiotic resistance and air pollution both can be linked back to the way we produce our food.
Yeah, Alison?
Sorry, it's scrap factory farming. We're just we've got a new library we've gathered all of the over the last couple of years, all of the research that we've used, and it's now in really usable chunks. It's just happened in the last week or so. So that might be useful.
Yeah, that would be great. Actually, it's always useful to have all the papers and evidence in one spot. So, yeah, for sure.
I'll go ahead and after the talk, I'll go ahead and send an email out to everyone with links to scrap factory farming and of course to plant-based medical professionals there, because I think that is going back to what I was talking about earlier about how to engage with your GP. I think the minimum to do would be to go ahead and forward the email address, not email, the web address of your website off to GPs, just to give them a base of reference point, just to help them get the ball rolling. Are there any health conference summits similar to COP and the G20, G7 summits that have been going on that happen in the medical?
Yeah, I mean, I guess in terms of sort of health conferences, each country has their specialty specific health conference, but more and more a lot of countries are having conferences dedicated to nutrition, if not plant-based nutrition. So it started pretty much in the US with Plantrition Project and PCRM all holding their conferences, which have now become a global globally attended. And we do the same here in the UK. We'll get back to conferencing next year, I'm sure. But not quite on that same level that I know of, people coming together or the policy makers coming together in that way. But a lot of these conferences sort of have outputs of sort of journal articles and policy papers and things that hopefully make their way to the policymakers. But in America, they've just had a conference at the White House on, I forget exactly the title, but it was something to do with food, hunger and health. And the American College of Lifestyle Medicine and PCRM were represented there, and obviously both organizations advocate for a plant-based diet and a plant-based food system. So there are opportunities, but not quite as in the same way that I know kind of COP galvanizes all the governments, even though it seems a bit of a waste of time most of the time, doesn't it, COP?
And yeah, you have a question there, Singh?
Yeah, hi Shireen.
Hi.
Specific question about anemia. Often seen in young women, and then if you give them iron tablets, then that can upset the gut. Any tips you've got? Any particular iron formulations or any particular vegan foods you recommend?
Yeah, so I mean, so there's not an increased incidence of anemia or iron deficiency in vegan or vegetarians, just that iron stores might be lower. And of course, iron deficiency globally, as you know, as a gastroenterologist, is one of the key nutrient deficiencies, specifically in women because of menstruation. I mean, you probably know already, but the guidance in terms of how frequently to take iron supplementation has changed, and it's not always trickled down into practice. So before we used to say take your iron tablet 3 times a day, but actually it's probably best absorbed and taken every other day, and that really reduces GI symptoms as well. So if you're not already recommending alternate day 200 milligrams of ferrous sulfate or whatever ferrous fumarate, I'm not aware of the different formulations making a big difference. I think probably just the frequency, reducing it, and not only increases absorption, but also dampens down the GI effects. And then, you know, food wise, it is about, you know, beans and greens. It's about adding some citrus at the same time as these iron rich foods, avoiding teas and coffees, you know, and yeah, but I think if you're already iron deficient because of heavy menstruation, you probably can't address it fully by food alone, and you are going to need supplementation.
That's grand. Thank you very much. Yeah, and just to touch a little bit on controversy, what are your thoughts on groups that do go through disruptive behavior in order to push for a plant-based food system?
Well, I say thank you on all our behalf. What else can I say? I mean, I think, you know, well, you guys know already that it's going to take all levels of advocacy to make the change, and, you know, civil disobedience or disruptive action has a past history of really getting the topic at the forefront of the minds of people that need to hear this message. So I think, you know, you need our sort of advocacy that's sort of academic or professional advocacy, and we certainly need your sort of advocacy, which is out there front and center, and we're grateful to have people like you doing it.
And one more very, very, very serious question. Can you eat too much broccoli? So if I had a bunch of broccoli, would I eventually turn into a giant broccoli?
Well, Michael, I think we might need to do that experiment. Yeah.
I think that'd be
some January, just eat broccoli.
I think that'd be something I'd be up for. Yeah, I do like my broccoli. Well, yeah, we're coming up past the hour here. Does anyone else in the group here have any questions while we're all together? All right, that's fantastic. Thank you so very much, Doctor, for coming along and chatting to us this evening. It has been absolutely thrilling. Yeah, and you're always welcome to come along and have a chat with us anytime that you'd like. Like I said, I'll be sending out a follow-up email to everyone tomorrow with a link to the chat and also links to all the web addresses that we've been talking about this evening. And thank you all for coming along this evening, and hope to see you again really soon on our next installment of Streams of Solidarity. Thank you very much.
Thanks, everyone.